The nurse administers 500 milliliters of piperacillin to a patient with an infection. It must be delivered over 2 hours. The IV has a drop factor of 5. How many drops will fall per minute, rounded to the nearest tenth, gutty per minutes? A. 24.0 gutty per minutes. B. 18.8 gutty per minutes. C. 22.4 gutty per minutes. D. 20.9 gutty per minutes. E. 20.4 gutty per minutes. The answer is D. 20.8 gutty per minutes. Prescribed dose of piperacillin equals 500 milliliters in 2 hours equals 250 milliliters in 1 hour equals 250 divided by 60 in 1 minute equals 4.17 in 1 minute. Drop factor equals 5. Drops per minute equals 5 multiplied by 4.17 equals 20.85 equals 20.9. The physician orders digoxin 250 microgram. The label states, 1 equals 0.25 milligrams. How many tablets will the nurse administer to the patient for 1 dose? A. 1 tab. B. 1.5 tab. C. 2.5 tab. D. 2 tab. E. 0.5 tab. The answer is A. 1 tab. Strength of available digoxin equals 0.25 milligrams. 1 milligram equals 1000 mcg. So, 0.25 milligrams equals 0.25 times 1000 mcg equals 250 mcg. Prescribed dose equals 250 mcg. Tablets required equals required dose divided by available strength equals 250 mcg divided by 250 mcg equals 1. The nurse reads orders set by the primary care provider. She has prescribed 6,000 units of heparin 6-hourly subcutaneous for the patient. The label on the heparin vial reads 1 milliliter equals 10,000 units. How many milliliters will the nurse administer to the patient? A. 0.8 milliliters. B. 0.5 milliliters. C. 0.9 milliliters. D. 0.7 milliliters. E. 0.6 milliliters. The answer is 0.6 milliliters. Available strength of heparin equals 10,000 units per milliliters. Prescribed dose of heparin equals 6,000 units. Amount of heparin that needs to be administered equals prescribed dose divided by available strength equals 6,000 divided by 10,000 equals 0.6 milliliters. The nurse prepares to administer medications to his patients. One order reads 0.4 milliliters of potassium iodide for expectoration. The label on the medication reads 1 teaspoon equals 325 milligrams. How many milligrams are contained in this dose? A. 22 milligrams. B. 24 milligrams. C. 26 milligrams. D. 30 milligrams. E. 28 milligrams. The answer is C. 26 milligrams. Available strength equals 325 milligrams in 1 teaspoon. So, 1 teaspoon contains 325 milligrams. 1 teaspoon equals 5 milliliters. Hence, 5 milliliters contains 325 milligrams. 1 milliliter contains 325 divided by 5 mg equals 65 milligrams. 0.4 milliliters contains 65 multiplied by 0.4 milligrams equals 26 milligrams. The nurse prepares an order of 600 milligrams ampicillin IM 8th hourly. The medication is available in powdered form to be reconstituted with sterile water. The vial contains 2 grams ampicillin and instructs the nurse to reconstitute with 4.8 milliliters of sterile water to obtain a concentration of 400 milligrams ampicillin per milliliter. How many milliliters will the nurse administer per dose? Round to nearest tenth. A. 1.6 milliliters. B. 1.5 milliliters. C. 1.2 milliliters. D. 1.1 milliliters. E. 1.0 milliliters. The answer is B. 1.4 milliliters. Strength of prepared ampicillin equals 4.8 milliliters containing 2 grams. 1 gram equals 1000 milligrams, hence equals 4.8 milliliters contains 2000 milligrams. So, 1 milliliter contains equals 2000 divided by 4.8 equals 416.67 milligrams. Prescribed dose is 600 milligrams. So, 416.67 milligrams in 1 milliliter. 1 milligram N, 1 divided by 416.67. 600 milligrams N, 1 divided by 416.67, times 600, equals 1.44 milliliters. Equals 1.4 milliliters.